Excerpts from the 4th Annual Report of the UNFCCC Hague Group on Population Policy. It is encouraging to know that the world's population growth rate gradually slowed during the 1970s, reflecting fertility declines in many developing as well as industrialized countries. The demographic situation is obviously serious, but it is not hopeless. The growing body of evidence demonstrates that population trends can be influenced by determined public and private sector programs. Data developed during 1979 reinforced earlier evidence of significant fertility declines in a number of populous countries, notably China but also including Indonesia, Thailand, Colombia, and most recently Mexico. Results have been achieved in many areas among predominantly poor, illiterate, and rural populations of varying ethnic and religious backgrounds. The keys to success generally include commitment of government leadership, effective delivery of family planning information and services, local community involvement, and an enhanced status of women, including education and employment opportunities. Improvements in health and economic conditions and hope for future progress appear to be important factors in motivating couples to desire smaller families. In a growing number of countries, for example, China, Singapore, and Thailand, economic incentives and disincentives have contributed to dramatic declines in fertility. Against this background, U.S. international population policy remains one of responding promptly and fully to requests for assistance. But we now need increasingly to focus on the extension of family planning information and services to all peoples as rapidly as possible, combined with programs to increase motivation for smaller families. By virtue of experience and resources, the U.S. cannot relinquish the leadership role in this area. Because of the security implications of population growth factors, and their effects in undermining the benefits of general development assistance, serious consideration should be given to expanding our population assistance in selected cases by allocations from the Economic Support Fund. If more funds were available, a worldwide effort could be launched, consistent with recommendations of the Almaty and Bellagio conferences, to extend primary healthcare services to all peoples by the end of this century. By linking family planning with basic maternal and child health and nutrition, a combined package of benefits at not unreasonable cost could produce hope and change attitudes in previously unreached areas. Such an effort would involve coordination among UNFPA, World Bank, WHO, UNICEF, other agencies and donor governments. We recommend that it be further explored in the context of North-South negotiations. The toll in maternal and child deaths resulting from consequences of excessive fertility and unwanted pregnancies is staggering. WHO studies indicate that the health of women and children is demonstrably undermined by pregnancies during teenage and late in life, by close spacing of children, and by high orders of birth. It has been estimated that for every 5 births in the world today, there are probably 2 induced abortions. The consequences of pregnancy and abortion are a major cause of death among young women in many developing countries, especially where effective family planning is unavailable. And, according to UNICEF, even now, millions of children die each year from malnutrition and related causes. So, one of their arguments intended to convince others that population reduction is necessary is that a lot of people are dying without it and abortion is rampant in its absence. The recent World Watch Institute study estimated that the number of rural people who are effectively landless would approach 1 billion over the next 2 decades, and predicted that conflict rooted in inequality of land ownership is apt to become more acute in country after country. Already the estimated proportion of rural families who are landless or nearly so is over 80% in such countries as El Salvador and Guatemala, and between 70 and 80% in Brazil, Ecuador, Peru, Bangladesh, and the Philippines. So, they are saying that people not owning land is a problem, but only if some people do. Abolition of land ownership and private property altogether, on the other hand, they claim, would solve all or most of mankind's problems. As a rural population growth increases the fractionalization of land holdings, as croplands are depleted due to over-intensive farming, and as job opportunities in the countryside diminish, the Third World is experiencing a virtual urban explosion. The UN estimates that, in only 20 years, some 40 LDC cities may contain over 5 million inhabitants each. Half of these may have over 10 million, including Mexico City at 32 million, Sao Paulo 26 million, Calcutta 20 million, Bombay 19 million, Karachi 16 million. By the year 2000, 3/4 of the population of Latin America will be living in cities. Provision of jobs, housing, and social services to numbers of this magnitude, over such a short period of time, will present difficulties hitherto unimagined by town planners and governments. The potential susceptibility of urban unemployed youth to extremism and violence will grow. Again, something which is here claimed to be a problem or facilitator of problems, in this case population influx into urban areas, is otherwise encouraged by the same system. On the positive side, something important is clearly happening, particularly in East Asia and parts of Latin America, when millions of women and men are modifying traditional views on family size and are accepting, and even actively seeking, contraceptive means. Information coming to light during 1979 reinforced earlier evidence of a downturn in traditionally high fertility levels in a number of populous LDCs, including China, Indonesia, Thailand, Colombia, and most recently, Mexico. Moreover, the large-scale successes of Indonesia and Thailand and certain pockets in Bangladesh and India demonstrate conclusively that poor, illiterate, predominantly rural populations can be motivated to change fertility behavior within a relatively short time frame. It seems clear that demographic trends can be responsive to policy intervention. And there is general agreement on the requisites of success. High-level political commitment to a population policy, effective delivery of a full range of fertility control methods, local community involvement, use of paramedical personnel, general improvement in the economic prospects of the poor, especially their productivity and a more equitable share in national income, better maternal and child health services, disease control, and nutrition services, particularly as directed against infant and child mortality, improvement in the role and status of women, including education and equal access to remunerative employment. Again, decrease in infant and child mortality is used as a means to convey that a program should be accepted which would result in the children never being born in the first place. I hope it is also clear by this point that their encouragement of women to become educated and to participate in the workforce and to become more independent financially, socially, etc. was only ever intended to cause women to have less children. El Salvador is an example of a small country with serious political and population problems. Rapid population growth, the birth rate has remained unchanged in recent years, aggravates its population density, which is already the highest on mainland Latin America. While a program exists on paper, it has not been pursued with strong commitment, and contraceptives remain not readily available. The El Salvadoran Civil War, which resulted in the deaths of a lot of El Salvador's people, wouldn't have anything to do with this, would it? The current state of population programs worldwide was also considered by a Bellagio Conference on Health and Population held in April 1979, the fifth such meeting of leading development assistance officials, organized by the Ford and Rockefeller Foundations. The conferees, who included representatives of state and aid, noted a complacency in the international community regarding population problems which seems unwarranted by objective analysis of data and trends. Discussions focused on expanding primary healthcare services as a promising avenue for reaching the vast numbers of developing country population which currently lack access to family planning. By the way, if you are in and/or from the U.S., and you think that this group is only concerned with population reduction elsewhere, think again. U.S. government population activities. U.S. domestic population policies. For purposes of completeness, we believe a brief statement of the U.S. domestic population situation is in order. As of 1979, the U.S. crude birth rate was 15.3 per 1,000 total population, while the death rate had declined to 8.6 over 1,000, resulting in a rate of natural increase of 0.67%. However, due to immigration, the full scale of which is not accurately known, U.S. population grew in 1979 at an estimated annual rate of 0.9%. Unwanted fertility remains unacceptably high, based on a 1976 estimate that 1 in 4 births was either unwanted or mistimed. Teenage pregnancies are a growing problem. The third annual report of this group addressed particular attention to the fundamental issue of the status of women and their participation in the development process. Access of women to education, healthcare, food and nutrition and income-earning opportunities was noted as crucial to both the quality of socio-economic development and to lowering of traditionally high fertility levels. The report concluded that, in addition to increasing our support for aid and UN programs designed to advance the status of women, we should ensure that U.S. diplomats are better informed and that they find appropriate occasion to encourage governments on these issues. The department requested all ambassadors, during 1979, to provide information regarding the status of women in host countries, as well as specific suggestions for diplomatic ways of encouraging countries to be more attentive to the problem. The responses indicate there has been some progress, however slow or painful, in advancing the rights and status of women over the past decade. Forces for change are reported at work almost everywhere, in an appreciable number of countries. New government machinery has been created to handle women's affairs, and active or potentially active women's organizations now exist which are or can become instruments for change. But this survey also clearly indicated that there remains a long way to go. Traditions of male dominance, some deeply rooted in religion, particularly Islam, rural conservatism, and sometimes the conservatism of women themselves, in many countries perpetuate injustice and make progress painfully slow. Implementation and enforcement of relevant laws are lax, and, in many countries, the laws themselves fail to provide women with equal civil, political, and economic rights, such as those involving property, divorce, and inheritance. Moreover, our embassies almost universally reported that such trends as urban migration and technological change put the heaviest burden on low-income and rural women, who are already the most numerous, disadvantaged, and defenseless class in their society. The International Development Cooperation Agency (IDCA) came into being on October 1, 1979, as a result of a presidential reorganization plan designed to place U.S. overseas economic development activities under the guidance of a single agency. Initially, IDCA is composed of the Agency for International Development Aid and the Overseas Private Investment Corporation, with a proposed third element, the International Science and Technology Commission, awaiting final congressional action. The IDCA Director, Thomas Ehrlich, is to be the principal international development advisor to the President and the Secretary of State. He is charged with preparing an annual assistance budget including multilateral as well as bilateral aid, reflecting a comprehensive and cohesive U.S. development strategy. The primary emphasis of its population assistance program continues to be to encourage the practice of voluntary family planning in the developing world. Thus, the aid program concentrates on making safe, effective, affordable, and acceptable family planning services readily available to all couples, by supplying contraceptive and related commodities and improving family planning delivery systems. Improving family planning methods through research, training of doctors and paramedical personnel, strengthening public and private leaders' commitment to family planning programs, designing programs which improve family income, child. In biomedical research, AID's efforts continue to focus on development of new and improved means of fertility control and testing the safety, acceptability, and efficacy of existing methods in various developing country settings. AID-financed research, much of it being carried out by the International Fertility Research Program and the Program for Applied Research in Fertility Regulation, has yielded some concrete improvements in contraceptive technology. AID has funded only minimal work in natural family planning, the only birth control method approved by the Catholic Church. We believe, in principle, that more research in accurate and usable methods of determining the safe period is of potential value worldwide. Operations research primarily entails pilot projects designed to examine alternative approaches to family planning programs, in order to improve the cost-effectiveness of U.S. aid. These studies are exploring such issues as free versus pay services, program administration, and combination of contraceptive distribution with health, nutrition, and other developmental efforts. In 1979, there were 30 completed or active projects in 18 countries. Section 104D. AID continued working to implement Section 104D of the International Development and Food Assistance Act of 1978, which requires that all appropriate development activities be designed to enhance motivation for smaller families. AID is trying to improve its ability to select development activities particularly likely to encourage smaller families. These include efforts to improve understanding of relationships between fertility and socio-economic change. For example, under AID sponsorship, the National Academy of Sciences has established a panel on determinants of fertility. Increase education, training, and employment opportunities for women. For example, under a grant to the Center for Population Activities, AID is supporting a program designed to give management and project development training to women in developing countries, assist these women to develop, fund, and run action programs designed to improve women's opportunities, and assess the impact of these small-scale action programs on women, their families, and their use of family planning. Inform LDC development planners and project designers. The Research Triangle Institute began work to assist some 15 to 20 African, Asian, and Near Eastern countries to incorporate demographic considerations in their development plans and to raise awareness of development planners to the impact of population growth on development goals, improve rural organization through cooperatives and other local organizations.